Keep clapping. Thank you very much. Thank you very much. And to give a befitting citation on our inaugural lecturer, please permit me to invite pharmacist Amaka Anukam of the Department of Pharmaceutical Technology and Industrial Pharmacy to come forward to give a citation on the inaugural lecturer. Please keep clapping for her.
Thank you very much. The Vice Chancellor of this notable institution, ably represented by the Deputy Vice Chancellor Admin, other principal officers of the University of Jos. Special guests here present. Professor NDIDI NGWULUKA. I think a round of applause should have accompanied the calling of her name. Distinguished ladies and gentlemen, today we gather to honor an exemplary scholar, Professor NDIDI NGWULUKA, whose contributions have not only advanced pharmaceutical sciences, but have also paved the way for sustainable approaches to drug development. A pharmacist by training, a pharmaceutical scientist by research, and an educator by profession with 20 years of experience in assuring quality in pharmacy practice, pharmaceutical research, and development. Having dedicated several years to research, education, innovation, and administration, Professor NGWULUKA is indeed a distinguished leader, scholar, and pioneer. Professor NGWULUKA's qualifications are quite extensive and impressive. She began her academic journey with a Bachelor of Pharmacy from the University of Nigeria, Nsukka. This was followed by a master's degree in pharmaceutics from the University of Ibadan. She then earned her PhD from the University of Witwatersrand in South Africa, where her innovative research focused on drug absorption through a multi-cross-linked nanocomposite platform. Her expertise is further complemented by a Doctor of Pharmacy degree, a fellowship from the West African Postgraduate College of Pharmacists, and her designation as a certified management consultant. As a professor of Naturapolyceutics, Professor NGWULUKA has brought new insights into the use of natural polymers in delivery of drugs, a term which our distinguished inaugural lecture helped to pioneer. It basically focuses on using natural polymers to optimize drug delivery and therapeutic effects. This field is pivotal because it leverages naturally occurring materials that are often biocompatible, biodegradable, thereby reducing the reliance on synthetic substances and lowering the environmental impact. Professor NGWULUKA's work in Naturapolyceutics not only enriches scientific understanding, but also promotes a sustained approach to drug design and delivery, aligning with green chemistry principles. Her contributions are extensively documented in over 50 publications, including thank you very much, including but not limited to research articles and book chapters. Indeed, her innovations have led to the filing of a patent in polymeric drug delivery matrices. A round of applause for her. Professor Nguluka's professional journey is a testament to her dedication to excellence in pharmaceutical sciences. Since 2004, she has served in numerous roles within the University of Jos, from faculty examination officer to deputy dean to head of department, and now is indeed the first female dean of the Faculty of Pharmaceutical Sciences. In her 20 years at the university, she has made substantial contribution to academia through administration, teaching, research, and the supervision of both undergraduate and postgraduate students. An award-winning researcher, Professor Nguluka has received accolades, including the prestigious Fulbright African Research Scholar Award, the C.V. Raman Fellowship, and the L'Oreal UNESCO Regional Fellowship for Women in Science. A round of applause for her. She has also led significant funded projects, such as the TET-Fund National Research Fund and institutional-based research grants, emphasizing her focus on naturapolyceutics and pharmaceutical quality. As an engaged member of the global scientific community, Professor Nguluka holds membership in professional organizations, including the American Chemical Society, the American Association of Pharmaceutical Scientists, the Pharmaceutical Society of Nigeria, and the National Association of Pharmacists in Academia. She has participated in and contributed to a wide array of national and international conferences, from conferences in the United States of America to the Pharmaceutical Sciences World Congress in Melbourne, Australia, where she has been invited severally to deliver lectures, and this reflects her global impact and standing. A round of applause again. Professor Nguluka's core competencies are vast. She excels in quality culture facilitation, executive leadership, I beg your pardon, as well as training and mentoring. With her adept communication and interpersonal skills, she's well recognized for her ability to bridge diverse perspectives, to promote collaboration, and solve complex problems. Beyond her professional accomplishments, Professor Nguluka is dedicated to promoting women in science, in mentoring future leaders, and empowering youth to self-discovery and excellence. Permit me to deviate a little at this point to lend my voice in an attempt to fully capture this amazing personality standing before us today. We at the Faculty of Pharmaceutical Sciences recognize the amazing qualities with which Prof has impacted our community. For instance, she is one restless and insanely energetic human being. Never a downtime with her. Never a dull moment. She's always brimming with possibilities and bursting with ideas. She does not take no for an answer. One moment you see her coming from one angle of the faculty, the very next moment she's coming from the opposite side, like a mirror image. That is Prof for you. As per her leadership capabilities, Gaskia, she gets the job done. She sure does. And if you work with her, you better not be a slacker. No excuses, no tardiness, no failures. Yet, amazingly, she manages to balance this cut and dry aspect with a truly loving and genuinely compassionate persona. Professor Nguluka places value on every individual she comes in contact with. no matter how much lower than her station they might be. She relates with staff and students alike with dignity and regularly engages in students' activities with plenty of gusto and lots of steez. She takes personal and unfeigned interest in the challenges people around her might be facing. She has severally gone out of her way, above and beyond what is required from a boss, to help people out. Professor NGWULUKA without doubt qualifies as a decent human being. A round of applause for her. And so this evening, Professor NDIDI NGWULUKA, we celebrate you today as a remarkable scholar, as a mentor and a visionary leader. Your extensive qualifications, your accolades, your work in Naturapolyceutics, and your dedication to the pursuit of quality, safe, and effective medicines serve as an inspiration to us all. Thank you for your passion. Thank you for your dedication. And thank you for your exemplary service. Distinguished ladies and gentlemen, with a thunderous applause, please join me in honoring our distinguished inaugural lecturer, Professor NDIDI NGWULUKA. Thank you very much.
Please be seated. The Vice Chancellor, sir, the management of this prestigious university, deans and directors, Senate members, the university community, Pharmaceutical Society of Nigeria, professional colleagues, friends here present, and friends online, students. Welcome to the inaugural lecture titled Naturapolyceutics, the sine qua non of drug delivery. God delights in concealing things. The scientist delights in discovering things. Nature is the ultimate pharmacist, creating diverse complex molecules with remarkable properties. Nature is what we see that is not made by man. Nature is what God has put in place for man's convenience, use, and pleasure. Nature speaks. And when nature speaks, we listen. When we listen, we benefit. We're healthier for it. The health space, indeed, benefits from nature. So in the beginning, in the classical era, the apothecaries, the early pharmacists, obtained the drugs and the drug carriers from nature. At some point, with increase in population, there was now a problem with regards to not meeting demands. And then that was also during the period that the field of chemistry was developing, and then we had petrochemicals. And so we moved from nature to using synthetic materials as active pharmaceutical ingredients and drug carriers. When we talk about drug carriers, we refer to the material that drugs are incorporated in, the processes and technology to be able to make that paracetamol tablet that you look at. It doesn't just contain paracetamol, it contains other ingredients that is able to make it the way you see it, and when it gets into the body, is able to disintegrate, and it helps to get to the site of action. So at some point, we now decided that it is time to begin to go back to nature. Why did we decide that? Because the synthetic materials was beginning to exert adverse reactions. And with that happening, everybody began to polymer, you attach another to it, just like the agriculturists do. And then we have cross-linking. In the case of cross-linking, the materials will have to be charged, maybe positively charged and negatively charged, so that they will be able to bind. Derivative formation, with that, what we do is we add functional groups. The chemists may have an idea of what I'm talking about. You may decide to add carboxyl methyl group or acetyl group. And when you do that, it modifies the natural polymer. Or you do the simple one, just have a polymer solution and another polymer solution, and then you blend them. When you do that, it has an enhanced property that is different from the individual polymers. So when we do that, the next thing we do is to characterize the polymer, because it's not enough for you to say, oh, it can do this. When you do that, someone will ask you, okay, what are the properties? How does it behave? So in that case, you will need to run some tests on the material to be able to say, this is what it does and this is how I can use it. So we will now determine the structure. Most times, if you want to use it in pharmaceutical industry, they want to know what they are using. So you have to know the structure of the material. So you can do that, and then you have to now decide, okay, what does this material contain? In the case of polysaccharide, for instance, you have to say, what kind of sugar? Is it just glucose? Or does it have another kind of sugar in it? You would like to know. Or if it's the proteins, you want to know about the amino acids. So those are some of the things we do. And then in the end, you want to see how does it behave when in the presence of a wide range of temperature. What will happen to it if I subject it to 50 degrees, 70 degrees, 80 degrees? What will happen to this material? And then we want to know, how does it flow? Is it able to deform? Because we appreciate such information when we want to develop a drug delivery system. A drug delivery system is like your dosage form, a drug carrier into which you incorporate the active pharmaceutical ingredient. So when you hear about paracetamol tablet, it doesn't mean that that tablet contains only paracetamol. So we need functional materials that will be able to ensure that the drug gets to the site of action. After you have done that, you will now prepare the dosage form and then characterize it to find out whether it actually does what it says it will do. So, remember we said that we're using mainly synthetic materials currently. We want to compare natural polymers with synthetic materials. Come from living organisms. Synthetic materials come from petrochemicals or chemical synthesis. Natural polymers are biodegradable. Synthetic materials, a number of them are not biodegradable. And then you can easily customize or modify natural polymers. But when it comes to synthetic materials, when you attempt to do that, you find out that it may lose its fundamental properties, and that can be a concern because you're simply trying to tweak it for an extra ability, and then in the end you lose the other abilities that you may have presented. It's safe and compatible with natural, and then it's quick because natural polymers have historical use in food and medicine. It becomes easier to be able to approve it. But however, when it comes to synthetic materials, you'll find out that you need to do rigorous tests and validation before you can use it. It's sustainable. We get natural polymers from renewable materials, and then a number of them are used in applications. Ladies and gentlemen, welcome aboard our botanical adventure. We will be making some interesting stops, learning about natural polymers hidden in the heart of our indigenous plants. Fasten your seatbelt as we embark on a journey into the natural world of natural polymers from nature. These are the stops. First stop is starch. Now the cassava starch, we extracted starch from cassava to make zero gel. When we talk about zero gel, we are referring to a solid material. First is a gel, and then when the liquid that you have used to make the gel evaporates, it becomes solid. That is called zero gel. So what we wanted to do was to find out if cassava starch can be muco-adhesive. What we refer to that is, we're saying we want cassava starch to be able to adhere to the mucous membrane. When it does that, you will be sure that the drug will be available long enough at the site of absorption or site of action. So that's why we look for mucal adhesive materials. And so when we tried it, we dipped some beads into the gel, dried it, made a mixture of our cassava starch with sodium carboxymethyl-cellulose, which is a modified natural polymer. So we washed an albino rat, we got the stomach of an albino rat, and then attached the beads on it. When we did that, we now decided to allow water to flow onto the beads because we're trying to look at the extent of detachment of the beads. The lesser the beads detach, we know that that material is a strong mucal adhesive material. So here you can see that cassava starch only detached about 20%. This one here is the sodium carboxymethyl-cellulose. It detached about 80% of the beads. And then this is a blend of the cassava starch and the sodium carboxymethyl-cellulose. So the more the sodium carboxymethyl-cellulose, the more the detachment. The more the cassava, the less the detachment. So this has about 90% cassava. That's why you have less detachment. So cassava starch has shown an ability to be able to interact and adhere to the mucus. So we also decided to extract some starch from rice, cocoyam, cassava, and maize to be able to be used for direct compression of tablets. Now, sometimes you may have some drugs that are heat sensitive or moisture sensitive. When that happens, you will be able to use the other methods that we use for tableting. So what we now do is to do direct compression, which is a very simple method. Mix the materials together and then compress. So we did that and we found out that the starches were able to compress directly without assistance, which is good. Now, this is very interesting for us. Our own indigenous material is able to solve our problem. Plantasis esculentus, what called by Birom, and then Risga by the Hausas, was a material we used as a stabilizer in formulation of Newcastle disease vaccine. Why did we do that? Because you find out that vaccines generally must be refrigerated. They have to be always in the fridge. But imagine an environment where there is no light a number of times. What could happen to the vaccines? So we began to imagine, what if we do this, formulate this in such a way that you can keep it outside. It can stay in a 25 degrees ambient temperature. Hopefully it will be able to still be effective. Because when it's outside the fridge for so long, the vaccines are ineffective. But what if we put a stabilizer that will be able to help it so that it will be effective? We did try that, formulated the vaccine using the modified Risga starch, and then we found out that it was effective. So even though it was outside the fridge, and we still tested, the vaccine was still effective. This indeed is a valuable solution to improving the stability of our vaccine in cases where we don't have electricity. We all use date palm, a number of us eat it, but in this time we decided to try it as a binder. Will it be able to form tablets? Yes, it did. So when it formed the tablet, we tested it to see how it was behaving, and we realized it was good. It's able to produce hard tablets and then release the drug incorporated in it, about 85% of it in 30 minutes, which was good for us. Next stop is Bombax gum. Bombax gum, we also extracted the mucilage from the red calces and used this as binder in tablets. Now, when we used it, we were using it for immediate drug release formulation, a situation where once you take the tablet, it breaks into pieces and the drug is available for absorption and action. However, when we did that, we found out that one, it didn't disintegrate and it released only 50% of the drug in 1 hour. That tells us that Bombax gum should not be used for immediate drug release. It should be used for sustained drug release, which means that you have a controlled release of drug and the drug releases over an extended period of time. So it simply so that we can't use it for immediate drug release, but it has a place. as a sustained release formulation. Our next stop is sesamum gum, kerikeshi. And when we tested it, we found out that it contains tannins, proteins, carboxymethylcellulose, alkaloids. And then we used an equipment to even understand that this simple test that we did, is it really true? When we did, we were able to find out that it contains hydroxyl group, carbonyl group, which confirms that it contains carbohydrate. And then the alkyl group and the amine group confirms that it contains protein. So we went ahead to use it as a suspending agent for suspension. When you have a good suspension, even though it's settled, when you shake it, it has to quickly redisperse. If it does that, it's a good suspension. So using kerikeshi as a suspending agent proves that it's a good suspending agent because the ease of redispersibility up and 14 seconds. So we went ahead to check a species of sesamum gum to form emulsion. Now, emulsion is what happens between oil and water emulsifying agent. You know water don't mix. So for it to mix, you need a good emulsifying agent for it to mix. And that's how you form the creamy emulsion that you see. Without that, the oil will remain separate and water will remain separate. So when we to form, we found out that yes, it forms an emulsion, but it was unstable. It only lasted for 1 week. For the remaining weeks, it had separated. Oil one side, water one side. So we realized that we couldn't use it as an emulsifying agent. We decided to use it as a stabilizer. So we had acacia as the emulsifying agent and kerikeshi as a stabilizer. And maintain the droplet size from 1.68 to 1.95, I beg your pardon, unlike acacia, which over time increased to 3.95. Now, having used kerikeshi to confirm that yes, you can use it for suspension, we tried it, you can use it as a stabilizer in emulsion. We also checked, and it could use it for direct compression of tablets. We now decided, okay, it's time to really understand and know what this material contains. So we did that and found out that the sugars are glucuronic acid, mannose, galactose, and xylose. So now you know what your kerikeshi contains. And then, of course, we also have trace sugar, glucose, rhamnose, and arabinose. These are sugars. I know we're only used to glucose and sucrose, but these are sugars. Then the structural analysis made it clear that glucuronic acid and mannose are the main backbone of kerikeshi, but these other sugars are like side chains attached to it. And we also discovered that it has good thickening property and it's visco. When we talk about viscoelastic property, we're referring to the ability of the material. How does it behave? How does it behave with regards to flow? If we apply pressure, what happens? And then it gives us impression on, can it be used as a gel or can it be used for sustained release? So we're able to get, however, for kerikeshi, we found out that this is the first day. By the second day, it had lost most of its viscosity. So that tells us that if we want a long-term material that will be able to, you prepare for a product that you can store for a while, Bombax will be the one you should use. For short term, you may try kerikeshi. Now remember we were talking about purification. This, when you extract kerikeshi, it's just like this. But we now thought it might be good to see how we can improve on it, because that means it's not only our desired polysaccharide that is here, but there may be other things in it. So we decided to pass it through a bed of sand. It's not the normal sand that we have. This is the sand called dimensionless earth. So it's quite well compact, and we're able to pass the material under vacuum. And then this was what we got. So we had something cleaner. Our next stop it's cellulose from rice hulls. I like this because it's from agricultural waste. So if we continue to use this, then it has a positive impact on the environment. It will reduce the pollution caused by rice hulls. So we extracted cellulose from rice hulls and we treated it to be able to remove the other materials that are part of rice hulls and remove lignin and hemicellulose so that we can have only cellulose. And we use the cellulose as a disintegrant. Like I said earlier, a disintegrant is what you add to a tablet so that once it gets to the stomach, it just helps to break the tablet into pieces so that it can make the drug available for action. So we did that and found out that rice hull cellulose had the shortest disintegration time. It did that because it swells very fast. Once it does that, it just bursts and breaks the tablets apart. So this is a biosynthetic polymer, and it's biocompatible. We wanted to use it to prepare a drug delivery system. However, when we did, it released the drug very fast. So we thought about it and said, okay, what should we do? We decided to add a natural polymer to it. So when we added the natural polymer to it, what we did was to have a solution of methacrylate copolymer and then sodium carboxyl methyl cellulose. Sodium carboxyl methyl cellulose is a derivative of cellulose. Cellulose is not soluble in water. Because cellulose is not soluble in water, if you want a material that is soluble in water, you may need to modify it. So a carboxyl methyl group had to be added to cellulose. When that was done, it became a soluble material. So sodium carboxyl methyl cellulose is a soluble material. So we had a solution of it and a solution of that. When we mix them, because they are charged, methacrylate polymer is positively charged, sodium carboxyl methyl cellulose is negatively charged, and it gave us an interpolyelectrolyte complex called IPEC. That reaction gave us this, which we used to make a tablet. And then when we decided to do dissolution to determine the rate of drug release, at the end of 24 hours, we found out that the tablet did not lose its integrity. It maintained its shape throughout the 24 hours, but it was able to release most of the drugs. So this is the profile, drug release profile for sodium carboxyl methyl cellulose. You can see that it released the drug faster than IPEC. Those are various compositions and concentration of the IPEC. Now, if it is sodium carboxyl methyl cellulose alone, you can see that it lost its shape. But that of IPEC maintained its shape. This was done at pH 1.5. Remember I said that we had to add a natural polymer into methacrylate copolymer because it was exhibiting immediate release. So it released most of the drug in about 1 hour. This was done at pH 1.5. Now we did it at pH 4.5. When we did it at pH 4.5, its behavior changed, giving us the impression that it's a pH responsive material. So what happened here was that the mechanism of drug release here is swelling and diffusion. While in this case, the mechanism of drug release is surface erosion, swelling, and bulk erosion. Now, it kept swelling. The swelling was actually quite about 465%. At some point, it burst into pieces. The implication of this is that there's going to be some kind of dumping of the drug. So you have a lot of the drug released at this point. We didn't like that because we wanted a situation that the drug will release at a slow rate over 24 hours. We don't want a situation where it will dump the drug at some point. So we had to do something about it. So that brings us to our next stop. We now thought perhaps it might be important to add a natural polymer into it and see what it will do. So we added the natural polymer. So when you have the IPEC plus locust bean gum, it gave us, yes, locust bean gum added some color to it. And then remember we had this burst release here that we were not happy with. By the time we added locust bean gum, we had this. You can see that the formulation is almost a straight line. This is our desire. Now, when is a straight line graph like this, it means that it's a zero order release, showing that it's releasing the drug at a constant rate over time. Why did we need this? Because the drug in question is levodopa, which is used in the management of Parkinson's disease. So levodopa converts to dopamine in the blood, in the body. When it does that, that means dopamine will be available for the patient. Dopamine is very useful. Every one of us has dopamine. Dopamine is very useful for movement, motivation, and memory. So when you see those that have Parkinson's disease, it's due to loss of dopamine. And then they begin to exhibit such symptoms like hand tremor. But if you're able to give them the drug and it maintains a constant release, it means that they will have dopamine available throughout 24 hours. That was our target, that's what our desire. So when we saw this, we were encouraged, knowing that we're likely going to get our desired result. So, having done that, we were now comfortable, and we now decided that it's time to prepare the formulation that we really wanted. We wanted to prepare a gastro-retentive formulation. What does that mean? A formulation that will stay in the stomach. Now, for us to be able to achieve that, we knew we had to do something. We had to see how we can keep that tablet right down here. So there are several ways of doing that. It can either float, or it can be dense, and it can swell, or it adheres. It should be able to interact with the mucous membrane so that it can adhere and stay. So we decided to be sure that it will stay a long time to employ three mechanisms. The swelling, the material already swells, and then we decided to add a muco-adhesive material, which is a natural polymer called pullulan. We added that, and we also added barium sulfate to be able to help it so that the material will be dense so that it can fall to the bottom of the stomach and stay there. Why are we doing this? Because the drug levodopa is what we call narrow absorption window drug. It has limited site of absorption. So if that's the case, you want it to stay long enough close to its site of absorption so it can release the drug as long as is needed. Levodopa site of absorption is just here by the duodenum. So we don't want a situation that the tablet will go and pass it and go down. Once that happens, we have lost the drug. So we wanted to be able to keep it here so that it can stay long enough and be absorbed right here. So that was what we did. After we have formulated that, we now decided to run some tests to confirm that we have achieved our aim. So we did. We determined the density, it was good. We determined the mechanical strength, it was good. We determined the porosity, and it was said to be mesoporous. When a material is said to be mesoporous, it means that the pore size is at nanometer range. Nanometer means 10 raised to power minus 9, tiny enough. But that was good for us because it will now explain how it can control the release of drugs slowly over time. We had done the drug release. We already know we are getting a zero order release, drug releasing at a constant rate over time. We now decided, okay, we want to look at the release mechanism. How is this material being able to release? We said, okay, we have seen it, but let's do the imaging so that we can prove that what we are saying is true. So that was what we did by using the magnetic resonance imaging. When we did that, we were able to find out that yes, this is pH 1.5. It stayed there. When you look at this, you will see that the material is looking this way, and you can see some particles dropping off there. That confirms that we're experiencing surface erosion. The particles are chipping off. Remember, we said it's a pH responsive material. At pH 1.5, it retains its shape. At pH 4.5, it loses its shape. This is what happened. This is pH 4.5. This is pH 1.5. Having sorted out our lab work and being sure that everything sounds good, we now decided to try the animal study. And what we did was to make sure we inserted a venous catheter because we're supposed to withdraw drugs over 24 hours, which was what we did to be able to help us. Now remember that we said that we are preparing a drug delivery system that should stay in the stomach long enough. So when we administered, we had to do X-ray to confirm that this tablet actually stayed in the stomach. When we did, we got good results. This was it at 0 hour, and this is it at the 7th hour. If you look, you will see the tablet right here, still there in the stomach at the 7th hour, retaining its shape. That's the same thing here and right here. Now this one isn't visible per se because this one broke into pieces, and I will explain. One of the things we also did was to formulate nanoparticles. These are formulations that you do when you finish. If you measure their sizes, they are at nanometer range, 10 raised to power -9. We did that because we know that nanomedicine improves bioavailability, and we wanted a situation where these patients, if they take it, that more of it will get to the cerebrospinal fluid. If it does that, then that means they will have more of the drug there, and it will help them. So we didn't just run the test, animal studies with just our tablets. We also tried to use what is currently available. Madopa HBS capsule used a floating system as to ensure gastro retention. But we ran that. This capsule is made by Roche, a pharmaceutical industry, for management of Parkinson's disease. So we're able to run, this is the blood samples, the concentration of the drug in the blood. Now when you look at it, you see that the one that contained the nanoparticles behaved not too far from this. But the difference was now that the one with nanoparticles actually had more of the drug in the cerebrospinal fluid, which was really good result. So just to quickly show us how we prepared the nanoparticles that we use, the nanoparticles I was talking about. We employed chitosan. Chitosan, you can get chitosan from animals, and you can also get chitosan from aquatic plants. So what we did, we had our methacrylate copolymer, and then we also had chitosan. I would explain further as we go on. And then we had lecithin and the tripolyphosphate. We used this to be able to achieve cross-linking. So when we did that, we were able to get our nanoparticles nice and cute, spherical as they are. And then this was the methacrylate copolymer. The material release had an immediate release. And as we had said, this is not something we really want. We want controlled release. So because it failed, first we tried it as the powder alone, and then after we compressed it, same thing, and then we decided to incorporate it into that IPEC plus locus bean, which we call IPB. So we did that and we compressed. When we did that, we now had some measure of controlled release. Because of the way it was behaving, we decided, okay, it would be important to add chitosan to it. That's a natural polymer. And indeed, it came to the rescue. And it was able to give us, this is just the powder itself. You can see that it did better than this one. And then when we compressed it, it behaved better than this one. When we added it to the IPB, this was what we got. This is a short presentation, but just to highlight the fact that we've had quite a number of other natural polymers that we have used in our lab. Sodium alginate, banana powder, griwa gum, Dika gum, and quite a number of them, okra gum and tamarind gum. Now, it wouldn't be right, as we are disembarking, to say that it's all good with natural polymers. But it will also be interesting to let you know some of the challenges we face when we use natural polymers. We have a challenge of variability. Kerikeshi planted here on this campus and the Kerikeshi planted in Unijust staff quarters, when you decide to test them, they may just be slightly different. So when that happens, it may pose some challenges. Now, we also have some materials that when you use, the mechanical strength may not be as good as some of the ones I have shown to you. This is where you can now decide to run some tests and select which of the natural polymer that will serve your purpose. If you want a natural polymer with very good mechanical strength, then you may now have to run the test to be able to decide which one to choose, because some of them have limited mechanical strength. Pore solubility, I had given you an example of what we did when it was when we had pore solubility of cellulose. We modified it so that it was now carboxyl methyl cellulose, which enhanced solubility. And then degradation, I had also told you that Kerikeshi, by the third day, Kerikeshi degrades. The degradation is a plus for natural polymers. But when you want to apply it, you may now decide whether you want to use it as liquid dosage form or tablet. Depending on where you want to use it, you prepare whether you want to use it long term or short term. Either way, when you continue to experience that, you may decide to modify it. Limited functionalization. So while we have said that we may need to modify it, sometimes some of them are difficult to modify. I know I said that we get regulatory approval with ease, but the regulators will also want to make sure that the material does not have contaminants. So it's a situation where when you come, make sure that you're presented to the regulatory bodies pure material if you want to use it for drug delivery system. Remember that we deal with humans, we deal with patients, so that's why they're quite careful. Cost and availability. It's easy to extract from Kerikeshi, but it's not easy to extract from tamarind seed. So tamarind seed is time consuming. Kerikeshi can happen, you can extract in a couple of hours. Tamarind can go into the second or third day because of the processes involved. So those are things that can be quite challenging. And of course, when you want to load drugs, for instance, I showed you the nanoparticles we prepared. When we prepared with methacrylate propolymer, it didn't load enough. But when we added chitosan, it loaded more. So when you're choosing, you choose the one that will be able to load more, because most times you want to load more drugs when you want a sustained release formulation. Remember I said that you get these natural polymers from animals, from plants, and from microorganisms. Sometimes the ones you get from microorganisms, some individuals may react to them. So sometimes what happens is that they may now decide, okay, if this material is so good, they may decide to do what we call humanization, so that the body will identify it as its own. So when that happens, then that takes care of the immunogenic reactions that occur. I think it will be necessary for us to understand some of the challenges we face with regards to research. Some of the data I had shown were data that we received or we did while we were outside Nigeria. We had to travel to be able to do some of the work. And then one of the challenges include inadequate funding. We don't have enough facilities to be able to do the kind of work that we want to do. We don't have the facilities to be able to even determine the nano size of any material to be sure that you have produced nanoparticles. So that's part of the challenges that we have. Infrastructure, a number of equipment are obsolete, and then we have erratic power supply. You know what that does? There's some equipment you can't buy and keep, because once you buy them, you install them. Once you install some of this equipment, they must stay on. And so if they must stay on, you now understand that in this kind of environment, we won't be able to install such equipment. Brain drain, we already know much about that. When the environment is frustrating, some people begin to seek better opportunities. That affects our human resources. I wouldn't want to spend time to talk about the bottlenecks that occur when it comes to universities. The stories are enormous, but I think a number of us can relate and identify. And of course, we have insecurity problem. While I was away, I could stay 24 hours, 36 hours in the lab, but I can't afford to do that here because the environment is insecure. Limited collaboration. When it comes to material sciences, those that study materials, you find out that if you're collaborating and you're in a project, what would happen? What kind of work will you do while your international collaboration will do? Maybe your international collaboration will say, okay, run some tests. And alas, you don't have the equipment to run the tests. So in the end, it will look like everything will have to happen over there. So those things, such challenges, limit collaboration for us. So Naturapolyceutics present a transformative advancement in drug delivery. We can really tap into the inherent properties of natural polymers to be able to make formulations that will work for the patient. And then we need to reintroduce natural polymers into our system, the pharmaceutical sciences. I have already intimated us of the challenges that we face. Now, embracing Naturapolyceutics is not about advancing the field of pharmaceutical sciences. It is about respecting and learning from the natural world so that we can be able to improve healthcare. The journey towards integrating indigenous natural polymers into mainstream medicine is just beginning, and with it comes a promise of a healthier, more sustainable future. I'd like to thank the university community. I want to start by thanking the management of this great university. When I think about it, I want to think specifically with regards to research. With regards to research, they have had to give us approval to be able to travel out, to be able to do some of the work. So I want to say thank you. Thank you to the management. Thank you to the registry for helping us out here. I also want to thank the deans and directors. I want to thank the Senate members. My interaction with you people have helped my growth and experience. I want to thank my dear faculty, my constituency. I appreciate you all. I want to thank the staff and students. Indeed, our environment has been a bit challenging, but we have tried now and then to make the most of it. I say kudos to you all. I'd like to thank my professional colleagues. A number of them here have decided to come and join hands with me so that we can celebrate this day. Thank you so much. I'd like to thank my friends online. Thank a number of my friends here that have come to visit me. If I start naming them right now, but I'm pointing at them so they know themselves. I want to thank you so much for being here for me. Oh, I really would like to honor my pastor, Pastor Dr. Reju, for making our time to be here. Thank you so much. And my friend came all the way from Abuja, Daisy Alabi. Thank you so much. Going. And we don't understand how much. But I want to thank my friends. A number of them are online. I want to really say thank you for celebrating me. Thank you for supporting me at this moment. I'd like to thank the Ojimosis family. Without them, I won't be standing here making this presentation. They were the ones that encouraged me. They were the ones that encouraged me to come to Jos. And I'm here, so I say thank you. And I would like to thank my family, the U-bosses. These are my cousins. They started calling me Dr. Ngus even before I did my master's. And when I got my PhD, they started calling me Professor Ngus even before I became a professor. So I want to thank them for celebrating me. And I would like to thank my mother's people, the LS, for celebrating me. I really appreciate them. I thank my father's people, the OGs and the NGWULUKAs. I want to thank you all for celebrating me. I want to thank Nibo City of Anambra South, of Anambra State. Sorry, Oka South of Anambra State. I'm their own, and they don't stop to celebrate me. I get overwhelmed sometimes when I keep hearing them rooting for me. I want to say thank you so much. I'd like to thank my siblings, Chukwu, Tijibe, Ngozi, and Emeka. They've always been there for me. Their support, their love, their listening ear. I really appreciate them. I can't stay here to list in many ways that they have helped me, but I would like to say thank you. And I would like to thank my father. If he ever got the chance to connect, good for him. I'd like to thank my father because every time he will always ask for weekly updates. He wants to know about publications. He wants to know about research. He wants to know about my role as an administrator. One day I had to rebel because the wahala was getting too much. Every time you have to keep saying, oh, this, that, and I got tired of talking about work, and I had to say enough. But I really appreciate him because even when I'm ready to talk, he gives me the listening ear. I appreciate him. And here I would like to thank my mother, Adele Asanwai Ochilunejiese. Though she's been gone over 20 years now, but she remains forever in our hearts. I remember when my bee farm was threatened. It was a financial issue, so I came to her and I said, "Sio," she said to me, "No matter what happens, this program, you will finish it. If I have to sell all I have, you will finish this program." And I finished the program. And every time I keep wishing that when I achieve a milestone, that she was here to celebrate with me. But I give God all the praise because He is indeed faithful. I would like to thank the one who gives me breath. He breathes on me life, His nature, and His ability. And I'll say, to Him be all the glory, because He has made this day possible. In the pharmacy of nature, natural polymers are the silent heroes. Let's get back to nature. Thank you.
Put your hands together for Professor NGWULUKA. Keep clapping, keep clapping, keep clapping. Thank you very much for that beautiful lecture. I believe we have all learned a thing or two things from our inaugural lecture.
Go ahead, Mr.
Let's go ahead. Okay, thank you.
Inaugural lecture. Please permit me to invite the Vice Chancellor of the
Thank you. Thank you. He's calling him.
the Deputy Vice Chancellor of Administration, Professor Pharmaceutical. This is
Thank you, sir. Thank you, sir. Thank you. Thank you. Thank you. Thank you.
I'm sure you are agree with me that
My friend. Thank you.
eloquently presented the 109th Inaugural Lecture of the University. This seems to have eloquency and the systematic presentation. I have no doubt that we did not make any mistake in making her, assessing her, and appointing her as the professor of natural physics and pharmaceutical. And today, you and I are witness a very great delivery. I will ask a simple question of everybody. Does she not deserve a professorship? So, on this note, I want to congratulate the faculty once again for this very scholar. A philosopher said, intellectuals they solve problems, but jealousies they prevent problems. But from his presentation, and from the research she has done, and the demonstrations she has made, the very technical and scientific methodology she has adopted, I have no doubt that she's not just a problem solver, but she has given us a very good presentation that will prevent problems. It's coming out of what I would call a very critical thinking. So the University of Jos is very grateful to you, our dear Inaugural Lecturer, for this year of research. You have demonstrated the confidence reposed in you by the university. And let me say that this is just the beginning. You still have many more years of service to this university. This university is known for tapping the best brains. So we'll still tap your brain for many more years to go. So therefore, thank you a lot. On behalf of the Vice Chancellor of the University of Jos, to present to you this very wonderful gift. What happens first? So this is a plate from the university, which is a demonstration of the merit awards that the presentation of today is worth. So this is presented to you. Keep it very dearly, where you can see it every morning, because it has given you some important confirmations in this university. And I dare say that we have formally unveiled you to the world that you are an authority in your area of research. Congratulations. I also have the privilege of presenting this gift to you. Silver and gold we have none. Just to let you know that this is not dollars. This is not naira. But this is a gift from the University of Jos in recognition of your industry, your sagacity, your research, and your contribution to knowledge in your area of specialization. We value you a lot, and we continue to pray for you, that God will continue to keep you so that the coming generation will also tap from your wide knowledge in this area. Congratulations. Let me now finally give you the Vice Chancellor's prayer that it shall be well with you. Amen. That his countenance, God's countenance will continue to shine upon you. Amen. Your knowledge will continue to expand. Amen. And you will make the desired impact, not only in Nigeria and beyond. And your labor will not go unrewarded. Amen. Not just in this university, but in this country. In Jesus' name. Amen. God bless you.
Thank you so much. Right, go now.
Please put your hands together for the Vice Chancellor and the Inaugural Lecturer after making your way back to the seat. Keep clapping.
Welcome back.
Thank you.
Welcome back.
Thank you.
People,
And then you came without this.
as well as everything
Okay. Huh?
Can you display this so that we take a shot? That's here. No. Check out this.
the chairman of the Pharmaceutical Society of Nigeria, Association, no other than Dr. My job here is very simple. It's to thank each and every one of us that is here present. But I must start by recognizing the deliverance and mercy of the Almighty God for granting us this wonderful opportunity to listen to the inaugural lecture in person of the mother of Faculty of Pharmaceutical Sciences, Professor NDIDI. We really give God the glory for such a special time and for that opportunity given to our life. I also want to thank Professor ably represented by our father, the senior advocate of Nigeria, Professor Amupta, who has been proud during this period. He is a good supporter of the faculty, and we appreciate for that. But we need more of support. In addition, he is not alone. He came with other principal officers of the university who are with him. We thank each and every one of you for exemplary leadership, without which nothing this inaugural lecture will happen. It is one product of your exemplary leadership in the University of Prof. We thank you and pray for more extraordinary lives. I also want to thank the deans and directors here present. We really appreciate each one of you for deciding to come and listen to this important inaugural lecture. I also want to recognize and thank heads of departments that are here. We thank each one of you. One thing that has lost our academics.
No, the site has not. I'm already connected to Jen. Decided to leave it at Jen.
Through research. That has always led me to love academics. Just like you saw in the presentation or in the inaugural lecture process. Seated here are important invited guests. who I may not be able to recognize personally or by their solution, but I cannot forget my immediate consideration the pharmaceutical side of Nigeria and the latter, and also NASA.
No, I'm just the program for the first time. Yes.
The leaders are here. We are preparing for you. Invited guests, we cannot say thank you enough. We really cherish each and every one of you. Students that are here present, thank you so much for taking the time to come and listen to this lecture. May it be the beginning for you to know we have this occasion with prayer, and we are going to end this occasion with prayer. So to lead us in closing prayer, we invite Professor Economy of Action to lead us in closing prayer. Gracious brothers and sisters, thank you because you are good. I want to thank you because you are faithful. I want to bless your holy name because you answered our prayers. We ask of you that you be with us from the beginning of. Ladies and gentlemen, please join us.